The Minister of Health, Professor Mohammed Ali PATE, says the Federal Ministry of Health is unable to implement its 2025 capital budget after receiving only 36 million naira out of the 218 billion naira approved for the year. Professor Pate makes the disclosure while defending the ministry's 2026 budget before the House of Representatives Committee on Healthcare Services. According to the minister, although the personnel budget is truly released and utilized, the capital component suffers a major setbacks due to the bottom-up cash planning system operated by the Office of the Accountant General of the Federation.
The budgetary allocation for the sector, for the Ministry of Health headquarters, well, I was going first to 6 to just give you a summary. It's 186 billion for capital, multilateral and bilateral 25 billion, overhead 1.5 billion, just similar to what we had in 2025. But you recall 2025, half of it was mopped up, and personnel costs the same as we had last year as well. Total allocation was 228 billion, and the big picture is that because 2025 had not been released, touched, it has been rolled over to 2026. And at a lower level with slight discount. What we can only work towards is to ensure that with resources being available, with the new direction that only projects that have resources should be awarded.
In his response, the chairman of the committee, Honorable Amos Gwamna Magaji, directs Professor Pate to submit all relevant documents on donor funds received by the ministry, including details of their utilization as part of the committee's oversight responsibilities.
One thing I wanted to understand is that for some of us that are even in the health sector, Abuja declaration was done in this country here. And then up to today, many countries have gone to move their budget up to over 15%. But for many years, the budget of health is still less than 10%. And our population is growing in millions. And we are dealing with a budget that is not growing in proportion with the population. So we need to understand that in budget. And many of the things, I'm quite aware, if the intervention we did in health institutions, if the budget of 2025 was fully funded, there was no request for, when we had an interaction with the head of agency, that means the teaching hospital and so, anybody that asks for house quarters, we approve it for them. Because we knew that that was the only way to expand the carrying capacity of many of the teaching hospitals. If the house, no request for house officers expansion was denied, because we know that except you do that, you cannot have that.